Yeah, let me maybe back up just a bit here. So when the virus really started expanding, and when we had our first case in Tulare County, and we saw what was happening statewide, we follow the CDC and the state's guidelines very, very closely. We also have two epidemiologists that are Dr. Raju and Dr. Boken on staff here, so really following the science, following the facts. We first wanted to protect our most vulnerable population. And so our skilled nursing facility that's located over on Court Street, that's a 54-bed long-term care facility. Most of the patients that are in those facilities have compromised health conditions to begin with. They would be the most impacted by the virus. And so we made a decision pretty early on to essentially lock down that 54-bed hospital and to not permit any visitors to that facility. With the one exception that a patient would be at end of life, that death was imminent, and we absolutely wanted to have a loved one there with them. We similarly then went to our West Campus, our 61-bed acute rehabilitation and skilled nursing unit there, and to our mental health facility on that West Campus. So last week, they also went into lockdown with only the exception of end-of-life imminent death. Then earlier this week, as the number of cases in Tulare County rose, as we had our first inpatient that tested positive, we really spent a lot of time, again, working with our medical staff leaders, working with our epidemiologists, looking at what was going on across the country, what the CDC was recommending. And it was at that time that really out of an abundance of caution to protect our patients, to protect our staff, our physicians, and our community, we made the decision to close the acute medical center to visitors downtown. So we have three entrances that come into the medical center. The entrance on the Asequia wing, right there off Asequia Avenue, the Mineral King wing that comes into the emergency department, and then on the west side of the medical center, the entrance into the ambulatory surgery center. So those are the only three ways that patients can now come into the center. Employees have to go through marked employee entrances and badges only. So with respect to closing the downtown medical center, we similarly are allowing a visitor for a patient that is, at end of life, is in hospice, is in palliative care, or it's likely that they're not going to leave the hospital, that they are going to pass away. So in that circumstance, we are allowing a visitor. That visitor must be the same visitor throughout the patient's entire stay. Although just yesterday we did determine that we would make exceptions to that obviously if that one visitor should become ill during the patient's stay, should contract the virus themselves, or is not able to be there, or is physically exhausted. Compassion is our promise. That's that's part of our mission statement, and the last thing we want to do is abandon compassion at this most difficult time in everyone's lives. So that will always be the foundation of everything we do here. So we will make exceptions in that circumstance. Also, certainly if mom is in active labor and is ready to deliver a baby, her husband, her spouse, her significant other her caregiver absolutely will be allowed in the hospital during delivery, and if the patient stays longer than the typical 1 day, that person would be able to stay with mom and baby throughout their stay. Also, patients that have dementia or are developmentally disabled or have difficulty being able to make decisions for themselves, then we will also allow a caregiver or a visitor in that instance. Again, ideally the same visitor throughout the entire stay. And then lastly, patients that are going to undergo a very serious procedure, open heart surgery, neurosurgery, cancer surgery. They've had a heart attack and they're coming in and they're going to be stented. Where risk of mortality is higher than normal, we will definitely allow a visitor in that circumstance. But really, in all other cases,
Baby,
we would
I like your hat.
we would like visitors, to really
Thank you.
respect their fellow community members and stay away from the hospital as much as possible.